92. Gotta get up.
Good morning and welcome to Good Morning Doctor. We welcome today Dr. Edwin Chng, Medical Director at Parkway Shenton, and we're talking about early detection through health screening. Good morning and Happy New Year, Dr. Chng.
Morning, Happy New Year.
Thank you so much for joining us this morning. This, to me, is a very interesting topic because I was just talking to some people about this. Because, you know, when you appoint your clinic under the new scheme, you do go for blood tests, you do go for a certain amount of screenings. And I was asking my friends whether they went. And the general consensus is, I don't want to go for screening. I'm frightened what I'll find out.
Yeah, people are just afraid to
They're
go
just
for health
afraid.
screening. They just don't want to know. How healthy is this, doctor?
Yeah, so I think we all should not be fearful of health screening. Health screening in general is easy to do, it's painless, and quite affordable actually under the many new schemes, the new government schemes actually, such as the Screen for Life, SFL, as well as the Healthier SG schemes, which actually give Singaporeans lots and lots of subsidies. So it's actually very affordable now.
How can we get over that fear of finding out, the results? It's like taking an exam,
Yes.
But I think most of my friends didn't feel that way after the examination. They knew that the results were going to come out, but they were always very confident.
Yeah.
However, a health screening is different. It's also an examination. You await the results.
Yeah.
But
You don't know.
it's not something you can control.
Yeah, I think to get over the fear, I think one has to try and talk to their doctors as well as to talk to their friends who have gone for health screening, and they can actually realize that it is actually very painless, and actually there's actually nothing much to worry about.
Yeah.
And if the result comes back as normal, then you actually have a sense of reassurance. And even if the results, touch wood, comes back as abnormal, we all know that early detection translates to early treatment, and early treatment translates to better outcomes.
Yeah, that is true. So, with that in mind, who then needs to go for health screening?
Well, as per most guidelines, people as young as 18 years old can go for health screening. In general, health screening, the type of health screening test depends on a few things: age, gender, as well as risk factors such as family history. So people as young as 18 years old should already go for health screening to screen for hypertension and obesity. And when you hit 26 years old for ladies, they should go for cervical cancer screening. When they hit 40 years old, the general population should be screened for cholesterol and diabetes. And at 50 years old, one should go for screening for breast cancer as well as colon cancer. So it all really depends on your age, your gender, as well as your risk factors.
Okay, there are a lot of parents now who are very guarded, very, I'm trying to think of the word, guarded about their children. If you had a parent that came to you with, say, a 6-year-old child and goes, I want a health screening, can it be done for a child that young?
He will ask why. Right, you ask.
Yeah, so I mean, we like what Glenn says, we would usually ask if they have any concerns. Sometimes it may be because there's a family history of, say, cancer, or family history of metabolic disease like type 1 diabetes. But yes, to answer your question, it can be done. But if there's really no risk factor, it may not be necessary, but we can still do it.
Okay. Okay.
I've heard someone say this once, It's like, and he was quite elderly actually, in his 60s, never gone for a health screening, ever, right? And what he said was, why should I go for a health screening? Why do people go for health screening? The more you look, the more you'll find something.
Which is true.
But that's exactly
That's what you're supposed
you want,
to do.
Right?
Yes.
You want to detect stuff early, as you mentioned, Doctor.
Yes.
Yeah.
Okay, let's continue to talk about this on The Big Show TV. Up next, Lato and Mariah Carey. This is Big Energy on Kiss 92. Yeah, so I think that's what some people, say. If you don't look, you won't know. If you keep on going for tests and all that and looking for something, you will eventually find something. But isn't that a good thing?
Yeah, because you don't want to catch it late.
Yeah, so health screening, like we own, like I mentioned before, you go for tests before you have any symptoms, and when you don't have any symptoms, it means that the disease is at its early stage, And when you have, when you detect it at early stage, then of course the treatment becomes easier, and then there are less complications. Yeah.
When we talk about health screening, what is health screening? A lot of people go, health screening is a blood test. Is it any more than a blood test?
Yeah, so health screening involves different types of tests. It could be just a simple blood pressure monitoring. It could be a checking of your height and weight to calculate your BMI, the body mass index. It could also involve blood tests, like you mentioned. Also, stool tests or urine tests to detect any abnormalities of your stools and your urine. And of course, it can also involve radiological tests such as a mammogram for breast cancer or X-ray for lung cancer.
At what point do I decide that I want to do it? Is it just an age, or do I have to feel something and then I'm going?
So health screening is supposed to be done when you don't have any symptoms at all. Yeah, because when you have symptoms, it is no longer considered screening. It is already an investigation to
Right.
see whether you have any disease. But health screening is supposed to be done when you don't have any symptoms at all. So yes, it should be done based on age, gender, and risk factor, whether you have any family history. So to decide what test that needs to be done at what age, best to speak to your doctor. Yeah.
So what are the common types of health screenings available in Singapore?
So Singaporeans are actually eligible for lots and lots of subsidies under the, as I mentioned just now, the Screen for Life scheme, as well as the Healthier SG scheme. So the health screening that are available for Singaporeans and PRs include screening for hypertension, obesity, diabetes, cholesterol, and then cancers such as cervical cancer, breast cancer, as well as colon cancer.
Yeah. For someone who has not done his or her research and just goes to her GP or whatever and asks for a health screening, if the person has absolutely no idea, the GP will probably recommend the type of health screening that they should go for, right?
Yes, that's right. So always speak to your doctor, and then based on your risk factors, your age, your gender, your doctor will prescribe the best health screening test for you.
But correct me if I'm wrong. I shouldn't actually, I mean, in my mind, I shouldn't be the one asking to be screened.
Why not?
My doctor should be the one saying, hey, look, you're 40, you should be doing this.
No, you can't put everything on the doctor.
But the doctor would know. He's got,
Yeah, so
am I right?
Yeah, so you're right, Flying Dutchman. So the doctor has a responsibility to actually ensure that you are screened appropriately at the appropriate age. So under the Healthier SG, if you sign up with a GP and stick to the GP will be responsible to make sure that you undergo all the necessary screening tests at the age that is recommended.
It's recommended.
Isn't that wonderful?
Yeah.
But then on an individual basis, we should all take charge of our own health.
We should.
So you imagine if you're taking charge of your own health, and then you've got a GP, whom you have a relationship with, right?
Yeah.
You'll be a dynamic duo.
Yeah, so Glenn is also right. We all should also take the initiative to go and see your doctor regularly, stick to the same doctor so that there's better continuity of care, and then always agree. I mean, when your doctor offers it, please do it. Yeah, don't have the fatalistic attitude and say, no, I just want to sweep it under the carpet. I don't want to do the test because I don't want to know.
Yeah.
We did ask our listeners to submit questions on our Facebook page, and Prashant is a regular contributor to our show. He's got two questions. He asks you to, if you could, explain a cardiac stress test.
Now, a cardiac stress test, the simplest test is actually running on a treadmill. So basically, you're trying to stress your heart by exercising on the treadmill, and based on that, it helps the doctor to determine whether there's any blockage in your heart arteries.
Okay.
Yeah. So, and if there are any abnormalities, then the doctor will ask you to go for further tests to confirm whether there's any problem with the heart. Yeah. So the most basic test would be running on a treadmill, but of course there are more advanced tests or more better tests which can be done, which includes the CT scan of the blood arteries, so these are some of the tests that you can possibly do. Yes.
He also asks about, and I've never heard about this, liquid biopsy.
Now, liquid biopsy is basically a health screening for cancers. So basically what they do is they just draw a blood sample, and use this blood sample to look for possibility of cancers.
This is where I'm looking at my cancer markers to see if they're high. Is that what they're looking at?
Yes, so it is similar to that, but it is a newer test which allows you to detect more specifically different types of cancers.
Oh, okay.
Yeah.
So remember, if you've got questions, just drop them onto our comment section of our Facebook page. We'll try and get the doctor to answer as many as we possibly
Okay,
can.
we're going back on air for a traffic update. That would be me today.
That is you. Yes, you're very good at it today.
One chance to make me blush. Second time is one to let. Now I found another crush. The lush life giving me a rush. Had one chance to make me blush. Second time is one to let.
Kiss 92 traffic.
Okay, let's take a look at the traffic. We know we've got the usual delays across the expressways. No big surprises there as you head out this morning. SLE towards the CTE, a vehicle broken down after Lentor Avenue. TPE towards the PIE, an accident at Sengkang exit. What else do we have for you? KPE towards the TPE, an accident at Tampines Road entrance as well. Look out for those areas. Please stay within the speed limit. Have everyone buckled up. Be safe as you drive today.
No one does traffic like the Flying Dutchman. All right, we're back on Good Morning Doctor, and our guest for this morning is Dr. Edwin Chng, Medical Director from Parkway Shenton, talking about early detection through health screening. Now, Doctor, what are some of the diseases that can be detected from these health screenings? For the benefit of people who have not been watching us on the Big Show TV, but who are listening to us right now on the radio.
So health screening in general helps to detect metabolic diseases such as hypertension or high blood pressure, diabetes and high cholesterol, as well as cancers such as breast cancer, colon cancer and cervical cancer. So these are the two main groups of diseases that you want to screen for.
Okay. But I can ask to be screened for other things?
Yes, of course. So if you want to screen for other conditions, yes, you can ask your doctor to screen for them as well. So this could be ranging from things like low blood count like anemia, liver diseases, kidney diseases,
Thyroid conditions.
so many other conditions that can be screened. Yeah.
Some of the things you mentioned earlier on, like diabetes and high blood pressure and stuff like that. I know we've spoken about this before, and I know of late. I mean, especially when we had the health minister, with us on the show, he was talking about high blood pressure and all that. High blood pressure is something that I think not many people take as seriously as they should. Is it correct when I say high blood pressure, if gone untreated for a long time, leads to damage of organs in the body, for example? So it is, in your opinion, is it very, very important to understand high blood pressure and to treat high blood pressure?
So you're right, Glenn. A lot of people don't go for screening for high blood pressure because it is, as the name it is always labeled as the silent killer because there are no symptoms, and usually people are well and they don't know about it until they go for health screening. So as you rightly mentioned, high blood pressure, if left untreated for long periods of time, can lead to damage of many organs and can lead to stroke, heart attack, damage of the eyes, and damage of the kidneys. So it can actually cause many, many problems. So it is very important to go for screening. And because of our diet, our lifestyle, high blood pressure is becoming more and more prevalent. And we see as young as 18 years old, and therefore people from the age of 18 years old should start to go for screening.
It's a crazy disease. Because, imagine that, right? I mean, you don't feel anything, but if your pressure is consistently high and you don't know about it, it damages your organs, as the doctor just mentioned.
Okay, it damages your eyes. That's what freaked me out.
Yes, it can cause problems with your eyes, can affect your vision. So it is very important to go for regular screening, yes.
Wow, that's absolutely crazy. I had no idea. Just going back to the liquid biopsy, we for those of you who are interested in it, and Prashant in particular, we will be speaking to a doctor about liquid biopsy on the 7th of February.
Okay.
So you'll get a lot more information there
Yeah.
on the 7th of February.
Okay, we are speaking to Dr. Edwin Chng, Medical Director at Parkway Shenton, right here on Good Morning Doctor. It is 8:15.
Kiss 92 Time Check.
Yeah, it'll make your eyeballs pop, bro.
Yeah, that's like
no.
no, but I didn't understand it, and we're getting a lot of questions coming through. Maul has come onto our Facebook and said, the last time I went for a screening, I was asked to select from different options like ultrasound or bone density scan. How do we decide what is a suitable option?
Now, it is always important to speak to your doctor. As I mentioned, the doctor will choose the most pertinent, most relevant test for you based on your age, gender, as well as risk factors. So in general, the bone mineral density should be done if you are, for ladies, menopause, and for men, if you are 65 years and above. These are based on the screening guidelines. But of course, it can be done if for younger patients if they have risk factors. So for example, if they have a strong family history of fractures, or if they are on any medications which can cause osteoporosis at a younger age. So in general, speak to your doctor and they will advise you on what tests are relevant or necessary.
Okay. In your opinion, why are more and more people here in Singapore coming down with high blood pressure? It's not just a sodium issue, right?
In general, yes. It's basically the lifestyle. So we are having more and more sodium in our diet, and of course, the sedentary lifestyle. We most of us have a desk-bound office work like yourself, so we don't work out, we don't exercise as much, and of course, weight as well. People who are overweight are more at risk of getting high blood pressure. So it's mainly the diet, lack of exercise, and weight.
What about this condition we have in Singapore of chasing the almighty dollar and continuously putting ourselves under pressure?
Definitely. So stress, pressure definitely increases the risk of high blood pressure as well. Lack of sleep, fighting with your family members or your girlfriend or your boyfriend, any form of stress will increase your blood pressure.
Right.
Yeah.
Which is why, for someone who tests their blood pressure on a daily basis, it's important to test your blood pressure perhaps maybe at the same time every day, once or twice. What would you recommend?
So the best time to check your blood pressure is actually first thing in the morning when you wake up, or say in the evening before your dinner, because obviously if you have a high sodium dinner, then your blood pressure can be elevated after the dinner. So I usually recommend my patients to check your blood pressure first thing in the morning when they wake up, or just before dinner.
And the same thing with your weight, right? You do it first thing in the morning, am I correct?
Yes. So first thing in the morning, because obviously then you have not eaten or you have not drunk water.
It's a truer weight.
Yeah. So and it's always best to check it at the same time so that you have a better comparison.
Yeah.
Sorry, I'm just laughing because it's so funny. Here I am talking about high blood pressure and you're talking about weight.
Because I find are they not connected?
Yeah, so
they are.
Overweight
They are.
leads to high blood pressure, yes.
See, if you're overweight, you do have I'm not as bad as you think, Glenn. I'm on track here.
Well, my mom checks because I've got a history of high blood pressure in my family. So all of us have a blood pressure monitor because we're a little bit kiasi, see, all of us.
Yeah.
So, my mom checks her blood pressure in the morning. I will check my blood pressure the moment I go home, in the afternoon at 3 p.m., at 5 after my workout. It's like, it's there, I'm like, can you please just stop doing that? After drinking.
Yeah,
you know,
go up.
I realized, no, the funny thing is after I drink, right, my blood pressure goes down.
Oh.
I think maybe I'm too relaxed after that.
Strangest person.
I'm serious. I'm not kidding, you
Because
know.
even
It's
on
like
my watch
so
when I
strange.
drink, it goes up.
Man, for me, it goes down. So I'm like,
That
is it correct or not? Then I'll check again. Second time, third time. Oh, then I
And
realized.
the more you
oh,
check, the higher it's going, surely.
No, the lower.
Oh
it
my
is.
goodness.
Yeah,
That's so strange.
I can be a 98 over maybe 65 or something like that after drinking.
Wow.
It's strange, right?
Maybe you're more relaxed. Like
I
what
th- I think so.
my
Yeah,
Dutchman said.
maybe.
I think so. Yeah.
Wow.
I don't recommend this.
Yeah,
to,
yeah.
to anyone. It's just me. I'm a freak like that.
Yeah. Jane has come on our Facebook page and goes, she has a family history of cancer. At what age should she start screening?
So it really depends on what type of cancer and at what age the family member got developed the cancer. So for example, if someone's has a first degree relative like the father or the mother having colon cancer at 50 years old, then the person should actually start screening at 40 years old. So 10 years before the parent developed colon cancer. So it depends on what type of cancer. So it's always good to speak to your doctor about it.
So also it is very important that we find out our family history because a lot of people don't ask questions.
Yeah.
They don't ask their parents, they don't ask their grandparents, so they really have no idea. So it really is important that we actually sit down and discover what our family medical history is.
I guess.
Yes, so when you speak to your doctor usually will ask about your family history as well, because certain diseases are genetic or familial, whereas others are not. So, based on your family history, then your doctor will recommend which tests are necessary.
Okay. Yeah. And let's talk about medication, doctor.
Yes.
Because here's the issue and here's the problem. Many people don't want to take medication. They don't want to take medication for high blood pressure. They don't want to take medication for
Diabetes.
cholesterol. I mean, diabetes, you have no choice, right?
No,
you got diabetes if you don't.
There are people who don't take.
Really?
Yeah.
Can they survive? I mean, if you
It's
have diabetes and not.
super dangerous.
Okay, so what advice do you have for people who know perhaps they have these conditions, but are trying to fight it? They don't want to take medication, so they try and change their lifestyles, but it's hard.
Yeah, so to be fair, there are the need for medication depends on a few things. Number one, the severity of the disease. So, for example, if the diabetes is already very advanced, very severe, then I usually will tell my patients, no, you really need to start medication because without medication, it is unlikely to get better. And number two, whether there's already any established complications. So, for example, if the patient has diabetes and the kidney has already been affected, I would say no. Look, without medication, it is your kidney disease will just get worse and worse, and it is unlikely to reverse with just lifestyle. Yeah, so it depends. So I usually look at two things first. Number one, severity of disease at diagnosis, and number two, whether there are already established complications. So if it is very mild for diabetes, they can usually try lifestyle modifications first. So weight loss, diet control, exercise, and sometimes in very mild cases, the diabetes can actually improve. So it is not true that all patients need to be on medication straight away. So on diagnosis it is very mild, you can always try lifestyle modifications first.
Okay. I guess I don't understand diabetes. I always thought for someone who has diabetes, right, they need like insulin jabs.
Yeah, is it just the jab, that blue thing and you shoot yourself with it, or are there other medications?
So diabetes,
Okay, doctor, hold on. He'll ask you that
I'll
question
ask you
again
that
when we go on
question
it. Bro, you do a traffic. I can't seem to access my traffic.
No
all the
worry.
time.
Kiss 92 traffic.
The AYE towards Tuas, an accident before Jurong Town Hall exit, avoid lane 1. SLE towards the CTE, a vehicle broken down after Lentor Avenue exit. TPE towards the PIE, an accident at Sengkang exit as well. Look out for that. We've got the usual delays across the other expressways. Please stay within the speed limit. Have everyone buckled up. Be safe as you drive today.
Good morning, Singapore. Welcome back to The Big Show and The Big Show TV. It is Good Morning Doctor Day, and we have Dr. Edwin Chng, Medical Director from Parkway Shenton, with us today.
Now, we were talking about diabetes just now, and I was asking the question, is it just the insulin shot that... I know because my mother-in-law uses it. It's a blue tube, and you shoot yourself with it. Is that the only kind of medication, insulin shots?
So it depends on what type of diabetes the patient has. So there's type 1 and type 2 diabetes. So type 1, it is a problem with lack of insulin production. So for type 1 diabetes, yes, the only treatment is for with insulin. For type 2 diabetes, which is more of a resistance to your own body's insulin production, then there are oral medications on not just insulin.
Okay,
Yeah.
so there are pills that I could take.
Yes, that's
okay.
right. For type 2 diabetes, yes.
Okay. The other question that's coming through, we've got a lot of questions coming through on our
Very
Facebook.
good.
Moll is asking, she's changed her job and her current blood pressure is 144/93. Where does that stand in blood pressure rankings?
So if this person has blood pressure consistently 140 or 90 and above, then it is considered high blood pressure. But if you have just one reading on and off, then it may not be high blood pressure. So you always look at the trend of the blood pressure readings, not just individual readings. Yeah, but anyone with blood pressure of 140 or 90 and above is considered high blood pressure.
What
Consistently, yeah,
consistently.
consistently.
Yes.
What
Consistently.
should we be on average? What should we be?
So ideally, it should be below 140/90.
149 below 140/90, you're
Yeah,
okay.
so 140/90 is the cutoff.
Oh,
Okay.
is it? I thought it was 120/80.
So to be very strict, anything below 130/85 is considered normal. 130 to 139, 85 to 89 is considered borderline.
Borderline.
Oh.
Yeah, so we have this, cutoff, which is considered borderline.
Okay, so don't panic for those of you who
Yeah.
have the high blood pressure monitors, because for the high blood pressure monitors, if it's above, I think 85 for diastolic, right?
Yes.
It says high there, so it's like quite
Yeah,
scary.
yeah.
You know what I mean?
Yeah.
So you're saying it's okay if it's just below 90 for the diastolic, 89,
So ideally below 130/85, but
138. I better write this down. 138 over 85.
130 over 85.
Or 130
Yeah, below
over-
130/85.
I see, okay.
Yeah.
Okay.
So 130 to 139, 85 to 89 is considered high normal or borderline. So you should already start doing things to try and reverse it by increasing your exercise, cutting down your salt intake, and losing weight if you're overweight.
Okay. So where did the 120/80 come from? I've been like
I always
working
thought it was
on
120,
those figures,
Yeah, I always thought it was 120.
I mean, that's the ideal blood pressure, but based on most guidelines, anything below 130, below 85 is considered normal.
Okay.
Oh
Okay.
my goodness. All this time I've been panicking, no? The moment I hit 130 unit, I said celery juice. Now, what are some natural remedies for high blood pressure, doctor?
Well, I don't really recommend natural remedies. I usually just tell my patients to do lifestyle intervention.
Okay.
So exercise, reduce your salt intake, and lose weight if you're overweight.
So when you say exercise, what type of exercise? I'm sure FD is asking the question because when I ask him to do this and that, he just cannot. My back aches. So for someone like, let's say he has high blood pressure right now, what can he do?
So the recommended exercise regime is actually 150 to 300 minutes of moderate intensity exercise a week. And moderate intensity would include things which makes your heart rate go up and makes you sweat. So things like swimming, jogging, cycling, and even brisk walking, is considered
It's just
exercise.
movement. It's getting yourself moving.
Yes, any kind of movements which makes you sweat and your heart rate must go up.
So, with that in mind, Fendi has come on, and this to me is a dangerous question if he's practicing this.
Fendi Ahmad? Or?
No, Fendi Ho.
Okay.
Can we stop taking our high blood pressure meds once our pressure stabilizes with regular exercise?
That's a good question. Do people have to be on the high blood pressure medication their entire lives if they start
Yeah.
taking it?
Yeah, so it is a myth that anyone who is started on medicines for high blood pressure, diabetes, and cholesterol will need to be on it for the rest of their lives. It is not true. I've got patients who have been started on medications, but once they, do lifestyle intervention like lose weight, exercise, control diet, and the disease condition improves, there is always a possibility of stopping medication, but this should always be determined by the doctor. It should be supervised, and the patient should not stop the medication on his or her own.
See, that's why we love Good Morning Doctor.
Doctor, you
because
learn things.
many people think that they need to be on medication their entire lives, but consult your doctor.
Yes.
But you would be on the medication your entire life if you've been through a procedure, say like a stent or something.
Yes. So, for example, if you have heart disease and you have got stents, yes, you need to be on medication for the rest of your life. But for high blood, diabetes, cholesterol, it is not true. But if you have heart disease, yes, you're right. Flying Dutchman.
Yeah.
What a waste. Good news for everybody except the Flying Dutchman. How many stents do you have?
One only.
Okay.
Please.
He was hoping you'll say like, you don't need to be on your medication anymore.
Unfortunately not.
Actually, for me, it's muscle memory. The medication now is just muscle memory. You get up in the morning, you take it, and you before you go to bed, you take it, and that's it. Yeah.
Okay, Dr. Chng, you are a very busy man. We got to let you go. But before we let you go, what is the one thing you wish for Singaporeans to take away from the session that we have today?
I just want to reiterate that health screening is painless, it's easy to do, and it is very affordable now under the many government schemes. So I hope that all Singaporeans step forward, go and see your doctor, and do health screening with your doctor.
Don't be afraid. Don't wait for it to be too late, okay? Do your health screening, as Dr. Chng mentioned, while you are well.
Yes.
Absolutely. And if you have any more questions, I mean, we can't deal with everything. If you have any more questions, there is a hotline that you can call. That number is 68123396. 68123396.
All right, this has been Good Morning Doctor. Thank you very much, Dr. Edwin Chng, Medical Director from Parkway Shenton, for taking time off to be with us today.
Thank you.
Thanks for tuning in to The Big Show's Good Morning Doctor, brought to you by Mount Elizabeth Hospital.